Welcome to our session, Four Employers Shared Job Quality Journey, Going Further Together. My name is Hope Arthur, and I'm the Director of Workforce Innovation at the Health Collaborative. As we get started, please take a moment and enter your name, role, and organization into the chat. It's my pleasure to kick us off by briefly sharing how this group came to be here, presenting this journey to you. The Health Collaborative's long-term care employer group formed about 4 years ago to address long-term care's specific workforce needs. And from the group's beginnings, the members demonstrated incredible trust and commitment to each other and to providing the highest level of transparency and their best practice sharing. They truly embraced the adage that a rising tide lifts all ships. Determining the challenges we wanted to tackle together, though, took some time. The group tested, researched, and evaluated several opportunities and landed on testing a shared resource navigator to provide support for their lower wage employees who they knew were experiencing a variety of real life challenges. We applied for and were awarded a National Fund for Workforce Solutions Bill and Melinda Gates grant, which has assisted in funding this solution, as well as provided evaluation and human-centered design facilitation to help each organization uncover and test new employee-informed job quality interventions. The best part, though, of the path we took was that when we kicked off this work in January last year, followed immediately by the start of the pandemic, these employers remained committed. And if ever there were a group that could have easily walked away from creating deep change in their job quality for long-term care facilities navigating COVID, would likely be top of the list. Instead, they've stayed the course through incredible challenges, and I am in awe of them personally, as well as of their commitment to improving their policies and practices to better support and retain their workers. So today, each of these employees will share about what they've learned on this journey, from engaging the resource navigator to working with Ramsey of Design Impact and finding employee-informed solutions, to implementing new job quality efforts and the impact each has created for the organization. Candide has a 30-plus year career in human resources, the past 10 of which serving as Director of Human Resources for Life Enriching Communities, providing strategic plans around all human capital related issues. She shares that our long-term care employer group has allowed us to collectively solve some of our biggest problems as an industry group in ways we individually might not have had the resources to. Nicole Breving has worked in the healthcare industry for more than 20 years, both in hospital and long-term care settings. She's the Corporate Director of Human Resources for Healthcare Management Group and continues to assist in their buildings on a day-to-day basis. Nicole shares that working with the Health Collaborative has provided her the opportunity to share with other leaders about obstacles and successes in the industry and to find ways to move the bar forward. Lois Mills serves as the VP and Chief People Officer for Otterbein SeniorLife. Her career started in engineering, so she brings a systems and process mindset to human capital strategy and tactics. She finds her group to be a great way to engage with like-minded fellow HR leaders to create solutions that focus on the long-term care industry as a whole, as well as on the employees who are blessed to be able to serve customers, older people, in their final season of life. And Beth Thress, Vice President of Human Resources for Maple Knoll Communities. Beth is responsible for the human resources, payroll, and scheduling functions and facilitates much of the organization's strategic and quality improvement initiatives. She's been with Maple Knoll since 2000 and has been instrumental in shaping their organizational culture, resulting in a highly engaged and satisfied workforce of more than 500 employees. But before we hear from them, it's my pleasure to introduce you to our first presenter, Ellen Frank-Miller, PhD, the founder and Chief Scientific Officer of the Workforce and Organizational Research Center. Ellen has spent her 30-year career collaborating with employers and national advocates and community-based organizations to conduct rigorous evaluation and mixed method research focused on managerial practices and frontline job quality interventions to help build an inclusive economy where every worker has a job worth having. Ellen will provide you with an overview of a new tool, Job Quality Maps, and demonstrate how they can help you with your own job quality journey. Ellen, let me turn it over to you.
Wonderful. Thank you, Hope. I'm so delighted to be here and to have had the pleasure to work with most of our panelists on this exciting journey. And I'm going to now share my screen and put it into presenting mode so that we can all see better. Thank you. So as Hope mentioned, I'm very excited to present to you a brand new tool that is just being launched. That's an evidence-informed method to make frontline jobs more impactful for organizational success and for worker well-being. So most people don't seem to know, but there are decades of research on the relationship between what we call job quality and the kinds of organizational outcomes that employers are looking for. And I'm going to give you some more detail on that in just a minute. But in this research, we find that there are very strong relationships between the ways that we design jobs and operate as organizations and the kinds of business success that we are all looking for. So the question, of course, is then, well, how to use this research to get better results. And after 15 years in human resource consulting and 15 years in academia, my discovery is that these groups don't speak to one another very well, but they can both benefit from learning from what one another knows. So as Hope mentioned, they are the recipient of a grant from the Bill and Melinda Gates Foundation through our partner, the National Fund for Workforce Solutions. And so these job quality maps were developed in cooperation with both. And what we've done here is created a model that correlates job characteristics with workforce outcomes so that organizations can really draw a straight line between them and figure out what to do to improve. So this is just a high-level overview of what the maps include. And I want to point out that on the left-hand side, we have what we're calling employer outcomes. And these should all look familiar to you as you've been trying to manage through this very unusual time with COVID. What the research shows is that the most important outcomes that employers have to deal with are things like turnover and tension, commitment to the organization, individual performance, engagement at work, and burnout. And what we have on the right-hand side then are a set of categories of characteristics of jobs that the research evidence shows are correlated with those outcomes. Now, what you'll see in a moment is that not every characteristic of jobs is connected to every one of these outcomes. So part of the purpose of the map is to help sort that out. So I'm about to show you the full model. Bear with me. You're going to have a moment to look at it. It is available on our website, and we will also be sharing these slides after the presentation. So what you see here again on the left-hand side are those 5 employer outcomes that I mentioned. And then on the right-hand side is the deeper dive into what each of the characteristics are in these categories that are part of what a good job is. So you'll see on the left-hand side, we have those little icons that are different colored diamonds that have letters in them. So on the right-hand side, you can see which of these job characteristics are associated with which outcomes. So let's take turnover and tension as an example. So you'll notice that many of these job characteristics include the letter T, but not all of them. So what that tells us is that in the research evidence base today, these things are connected to turnover and tension, but others are not. So let's look at the category pay and benefits. So both wage levels and benefits, which primarily what has been studied are health insurance benefits, those are associated with turnover and tension. So better pay, better benefits, lower turnover and tension. If we look at burnout, for example, though, burnout is not associated with pay and benefits. So if your primary challenge is that your employees are feeling burnt out, adding additional benefits, although that's a wonderful thing to do for employees, that's not in the evidence base shown to be related to reducing burnout. So if your goal is to reduce burnout, then, for example, looking up at the top of the map up here, dealing with what we call role stressors is more likely to help reduce burnout. And I'll go into a little more detail on that in just a moment. So when I present this somewhat overwhelming model, every time I get asked, well, which one is the best? Which one is going to help us to get the best outcomes? And I'll give a researcher's answer, which is, well, it depends. But what I'll show you here is that you'll notice there are 4 different categories of characteristics that are associated with all 5 of these important employer outcomes. So if we're looking for a place to start, this is a place to look at. Now, what I'll say is that, for example, when we're talking about role stressors, there are 3 different types that can be addressed, and all 3 of them are connected to improving commitment, reducing turnover, et cetera. So when we talk about role conflict, that has to do with when I'm in a situation where 2 different people are telling me that I need to do something and one is in conflict with the other, or the way my job description is written, if I succeed in one area, I can't possibly succeed in another. So for example, I may have a set of, if I'm environmental services, I may have a number of rooms I need to clean in my shift, and then there's a stat request, and now I have to go clean an additional room. Well, I still have to finish those 7, and I may or may not have permission to work overtime. So that's what role conflict looks like on the ground. Role clarity is whether or not my job is defined in such a way that I really know what is it that I need to do to be successful in my role and to meet the goals that are before me. Role overload, exactly what it sounds like. If my role is defined in a way that is too big for one person to do, I'm going to experience role stress, and all of those outcomes are less likely, to be successful. So the big takeaways here, I think, are that every employer is different. We all face different kinds of challenges. We have different organizational contexts. Many times you may have different mix of residents or different types of care facilities in different locations, different labor forces. So it's really important to look first at what is your particular employer context. And as I say here, many roads lead to Oz. There is no yellow brick road, no single way to make jobs better. But every employer, no matter what constraints they face, can improve job quality for greater impact. And the process through which we talk to employers about how to do this is to really start with identifying your business imperatives. So what is in your strategic plan? What are your most important goals for 2022? That's where you begin, because once you've identified those goals, you can then relate them to those 5 workforce outcomes to say, where is our top priority? And of course, we all want all 5 of those things to happen, but when we're dealing with trying to make change, it's best to be focused. So look at the most important outcome there, and then you'll look at the right-hand side of the map and look at job characteristics. Where is a place that you can successfully make a change? And it's important to say, well, we can think about where we can make change, but will it be the right one? There are so many choices. And my response to that is ask your employees what their priorities are. You now know the universe of possible changes that will get you the outcome you're looking for. So ask employees where their priorities are and then match your change to their. Involve your frontline workers in actually developing and deploying whatever change you're going to make. And Ramsey from Design Impact has a lot to say on that topic and is a wonderful advisor in in executing that process. And then as the researcher in the room, I will now say, please measure. Before you make a change, take a baseline measure of where you are. And after you've been implementing your change for a period of time, measure again. And if you do this, you'll have the opportunity to continuously improve and evaluate how effective what you're doing is. And with that, I will turn it over to Candy Day, who will continue from here.
Thanks, Ellen. Good morning, everyone. My name is Candy Day. I'm with Life Enriching Communities, and I'm going to talk a little bit about our experience in working through this Design Impact and working as part of the long-term care group. So let me get my slideshow prepared here. So like many of you, one of our organizational objectives is to improve associate retention. We've had this as one of our organizational objectives for a few years now. Working with the long-term care group, the other panelists, my good friends and colleagues, we've identified common areas of concern. And one of them was, how can we remove barriers that are preventing our associates from maintaining their employment, particularly our low-level earners? Through the Bill and Melinda Gates grant money, we are working to resolve that by providing our associates with the resource navigator. We also spent some time talking about how can we increase retention by improving job quality, working with Ramsey and Design Impact through the human-centered design process. So the first thing that we did was to create focus groups. We brought in some of our frontline staff members, and we had questions designed around a variety of things, including culture and teamwork. We had a word bank. We did a Mad Lib exercise. We talked about ownership and trust and trustworthy, accountable leaders. We were really trying to work towards improving engagement. What we heard from our associates, and these are direct quotes from our notes from those focus groups, were things like we need to build trust with each other. We need to increase communication so others know what's happening. We need to change communication and increase meetings. There's a new idea, increase the number of meetings, right? To be sure that everyone understands expectations. That messages often get misunderstood because we're a healthcare operation that operates 24 hours a day. It's kind of like telephone, right? You start in the morning and tell people things, they pass it to the next shift, who passes it to the next shift, and it really changes. The message gets changed. And so messages get misunderstood, and that we need to limit the possibility of missed interpretations. So having received that feedback, we created 3 challenges that we wanted to focus on. How might we adjust our culture so that all associates are seen as powerful contributors to the whole? In other words, we wanted every one of our associates to recognize that their voice really mattered. For example, we were already having shift change meetings with our nursing staff, but to include our STNAs, we could get a broader picture of what was happening with each resident. A good example might be, perhaps I'm really looking forward to a visit from my family today. Something happened and my family didn't come, resulting in me feeling very sad, depressed. I'm not interested in eating. So what the nurse might see is that I didn't eat my meal, but what the STNA knows is that that visit really meant a lot to me. And so cumulatively, having everybody share in that experience of what happened to Candy today, we get a much broader picture of what's going on with each resident. So we really needed the STNAs to understand their input really mattered. So our first challenge, adjusting our culture so that all associates are seen as powerful contributors. Our second challenge, how might we ensure that organizationally, we value quality staff relationships as part of defining business success? How do we put the spotlight on those relationships? We spend a lot of time in our organization talking about the relationship all of our staff members have with our residents. We do a tremendous job there, but we don't spend as much time talking about the relationships among colleagues. So we really wanted to create a definition of business success as being quality staff relationships. And our third challenge was, how might we recognize that valuing diverse perspectives, equity, and inclusion is seen as part of job quality efforts? Recognizing that people hear and see things from different lenses, and how might we embrace that? We created an assumption after a lot of work. Walking through this, it sounds like, oh, step 1, step 2, step 3. We spent a lot of time analyzing the organization, the feedback that we received, and we built this assumption that if we were to improve the communication skills among our team members, we would therefore improve morale and raise engagement, which would reduce our turnover. So through the design impact process, we ultimately led to development of prototypes. Ramsey was very clear in explaining to us that prototypes need to be very flexible, and ours went through a number of edits. We talked about team huddles. How can we involve all involved in the shift at the end at the end of the shift change? How can we involve everybody in that team huddle? We started on 5 days a week. We moved to every other Wednesday and Friday and Monday morning. We talked about how to do it, how long could it be. So it went through a lot of revisions. Based on the feedback, we used a prototype group and we walked through several scenarios, collecting feedback along the way. What we asked our associates were at the conclusion of the huddles was whether they felt seen and heard, whether they felt they had the information they needed, whether they felt attending the meeting was good use of their time. We made attendance purely voluntary because it was at the end of the shift. It was paid time on the clock, but it was voluntary whether they could stay over, whether they felt better informed about their residents, the team, and the campus, and whether they felt more closely connected to the team, because we really wanted to build that core workforce. And as you can see from the results, unilaterally, everybody felt that the huddles gave them the information they needed to do their job. But we were really impressed with the other responses as well. Most associates felt that the meeting was good use of their time, but predominantly they felt seen and heard by their supervisors, which was one of our original challenges. So what we did after receiving that feedback from our frontline staff, we rolled this out to our leadership team. We made the agenda and the icebreakers widely available. Our intention is to grow this concept of team huddles organically. We don't want to require this. We want leaders to be able to see the value in doing it and to move forward with it. So we have a common drive where the agenda is stored, and you can see the agenda is very broad. You know, there's a greeting and icebreaker, there's organizational announcements, and then there's team daily discussion and problem solving. We included icebreakers because we really want there to be a moment where colleagues can get to know each other on a different level than just what happened at work today. Intentionally, the meeting is designed to be very brief, 12 to 15 minutes. One of the unexpected results that we got through this process was a real shift in thinking. When we start to hear our leaders say, before we go any further with this, let's bring in some of our frontline staff and run this idea past them or see what they think about this. So we were really pleased that we were hearing a change in how we're handling our problem solving and troubleshooting, and that we're really changing the culture to involve all of our associates, and that they're recognizing that everyone's voice really matters. So we were really pleased with our results, but continue working on it. Right now, we're working with Ellen, who's helping us to find ways to further, we'd like to really say, you guys, these team huddles really work. Everybody must do them, but we have to stop ourselves from going there. And so Ellen's helping us to find ways to broaden the impact. So that's been our experience. Now I'd like to turn it over to Nicole, Nicole Breving from Healthcare Management Group.
There we go. I think I'm good now. Thank you. Thank you very much, Candy. So what I'd like to talk to you a little bit about today. Good morning, by the way. I'm Nicole with Healthcare Management Group. This morning, I'd like to share with you a project that we participated in along with the ladies here on the panel. So 4 total local facilities, long-term care facilities during 2020. The timing we were able to execute and launch this project was far from ideal. We started with our resource navigator position in late February, early March 2020, right when COVID hit. We had worked on this project about a year ahead of time, I believe 9 months, a year ahead of time. And along with Hope and our awesome grant writing, we were able to secure funding and hire a resource navigator. With this contracted employee, what they did for us was able to help connect our employees with specific needs to get assistance from various resources throughout the community. She was able to point them in the right direction, assist them in actually applying for assistance, and counsel them as well during these visits. Another component of this position was Chantel being a licensed social worker. I think this also helped because it became more of just a quick fix for the month type of thing for the employee. She was able to sit with them, counsel them, give advice, and continue to do so even after the monetary assistance was given to them. The idea of focusing around retention is if basic needs can't be met, then the likelihood of them being able to keep a job is even harder to achieve. We have that saying to kind of leave your home life at the workplace door when you come to work, but that's really hard to do if you're not sure if you're getting evicted that day or if your electric's going to be on when you get home from work. So it does impact their work lives in so many ways. Now, the idea was for Chantel to come on site each one of our facilities 1 day a week so that she could meet with them in person one-on-one. Unfortunately, with COVID shutting our buildings down, she had to work remotely. I'm going to share a slide with you, and you can see by this slide what we were able to, how we were able to assist. So give me just a moment here. Okay, so we were able to assist 12 of our key employees and able to get over $22,000 in assistance, mostly in aid in rent and utilities. You can see it's quite a bit of difference there. This may have had something to do with our employees living check to check and COVID hitting. Keep in mind the stimulus monies weren't coming in at this point in time. I'm not sure, but all of these 12 employees were in one department, and that's our dietary department, which is, of course, a very low earning employee. This is key indicator, I believe, because Chantel was available to all of our departments, throughout the facility. We had meetings on her services with all of our employees, all departments, all shifts. So this is where I would like to point out a key component of its success. And that is having a manager and a human resource director that was really plugged in to their employees, that really cared about what was going on in their lives, knowing them well enough to know when they were in need, and most importantly, had built that trust so that the employees became more comfortable enough asking for and sharing their very personal details about their lives and getting help that they really needed. I find that a key in employee retention is the relationship with the employees, them knowing that we care, wanting to help them better their life situation, whatever that may be, and really investing in them. With our employee market today, which I never thought would ever be this drastic of a change, I'm sure most of you would agree, we have to focus on retention now more than ever. I mean, a pizza party is great. Don't get me wrong. Everybody loves pizza, but it's not going to hold anyone in a position. And with competitors, with the wages being higher than we can pay, it's key. We don't have the luxury in raising our chicken prices or price of a Big Mac. So we really have to dive into our employers and make that connection. I think that the navigator position was a success. I can't imagine that if COVID hadn't occurred, how much of a success it would have been, because I truly believe that unfortunately COVID did impact the total success of the navigator position. But if that hadn't happened, I believe it would have been drastic. Now, I'm not saying that we were able to retain all of these employees. We weren't, but we were able to retain most of them. And knowing that we did make a difference in their lives and their family lives, I think is something we need to hang on to as managers and directors during these times where burnout is so unfortunately high on all different levels. We have to have a purpose in what we're doing. Resident care is key, of course, but employee health and well-being should be another top focus. And sometimes I feel like we forget what those focuses are or who we're really trying to focus on. The managers and the directors have to come, at the top. If they're not happy, they're not going to be able to be plugged in and make that dietary aid happy and successful in their job, and maybe a promotion to an aide. So that's really key. I know I am getting probably close to my time allotment here. So hopefully I've sparked an idea for you and your facility in a way to get your employees to stay within the organization and within our industry itself, which is so important, which right now we're seeing, everyone's struggling, I know, for employees, but I feel like in our industry, people are leaving in droves, and there's really not a lot of people coming into our industry. So we've got to figure out a way to do that. So I'm going to pass this along to Lois Mills. Lois, let me unshare my screen here and pass it along to you. Thank you.
Thanks, Nicole. And good morning again to everyone. My turn to share screen. And hopefully I got it done correctly. Okay, so Otterbein, Lebanon is one of our 17 locations at Otterbein SeniorLife. So that was the focus for the Design Impact Group. And as you see, we had 4 frontline partners and 2 exempts on the team. Our goal was simply to make jobs better and to develop leadership skills for the core team. So I'm going to give you a flavor of what we did, focusing on the work that the frontline leaders did and how exciting it was to see them grow and develop as they got involved in this process. So as Candy spoke to the design impact process, you can see here's a quick chart of it. And when Ramsey first introduced it to us, we're all like, huh, what are we doing? But through the various meetings over various months, we got it. And what was so exciting was that the frontline partners did most of the work. So for example, we also held focus groups. It's not so important what's on the chart as to the areas we focused on. The important message is that the frontline leaders led the focus groups. So one of the exempts and I were in each focus group, but we're kind of in the back, just occasionally adding a little something, but they're the ones asking the questions from their fellow workers. They're the ones taking notes and trying to see what's going on. So yes, I did pull all the notes together, did the typing to put them all in a document, but it was their work to frame the questions, ask the follow-up questions, lead the meetings. And it was just so exciting to see them doing it and finding out, oh yeah, I can do this. So I wanted to cover a couple of different tools we use. One of them was the how might we, which I've used now in other parts of my job. So one of the things from the focus groups, we identified communication. And so the tool helped us ask, well, what do we want? So we said better communication between departments, workers, and management. Know what's going on, be on the same page. Well, how would we, in order to change what? So our partners, which we call our partners, our employees partners, would know on a daily basis what's going on. And so the flip to make your mind think differently was how might we have a simple way to have better communication between management and floor staff and departments to allow our partners to have a more successful day. So as we kept thinking about that, we came up with some ideas. And I'll talk a little more about those ideas. Another area the focus groups told us was that our new partner orientation pretty much sucked. Sorry, maybe it's not a very good word, but it was pretty awful. It was pretty much compliance, quickly get it down, what they had to do, sign off, this policy, that policy, get it all done, and get out on the floor. And what we found, our focus groups told us, that people weren't really connecting, weren't engaging. So one of the tools we use is called storyboarding. Not my artistic work, one of our team members' work, but design what we wanted. We wanted to have a welcome, a tour, tell about our history, make it engaging, make it interesting, have resident stories, make it interactive, and get rid of all that paperwork. So this was another tool that really challenged your brain to think differently and to see it. So one of the next steps is to prototype your ideas. Simple, not very expensive. So this was ours. We set up this table in the lobby, and you like our little "do not pass us by." So we had little donut holes for people. But basically very simple. We explained what the partner app was, the idea of a phone type of app. We all use our apps. And they simply had to put in a blue coin if they said, yeah, I'd use the app, or a red coin. No, I don't think I would. What was nice was we got about 40% of all our partners to participate. So we felt confident and, overwhelmingly, yes, this is something worth investing in. So we did. We did a further prototype. We connected with a company called Touchtown and created our partner app. With various categories, various icons. We changed icons with lots of different things after the prototype. And I'm thrilled to say just last week, we launched it. And so far, we got very positive feedback about our partners' ability to find out what's going on. Our slogan, everything you want to know at Lebanon from A to Z. So that's been a real success. Our next area, again, was new partner orientation. And I'm just going to share the progress we've had in that. This was all the ideas that came out of the focus group, came out of the frontline partners, and we went into execution. So though we haven't got it all done, we're starting a few things. So now we have orientation. We have this big welcome banner in the not in the doorway, in the lobby way. We have cutouts of partners with arrows directing them to the orientation room because people were getting lost. We have a poster with our slogan, Otterbein New Partner Orientation is a Journey. You'll have fun learning about your job, our values, and how you can chart your path to a successful career at Otterbein. So it's right there in the room. So we've already gotten started. You might wonder about this. We created, with the help of Red Carpet Learning, a culture video to introduce people to our culture. And so part of the video had fun bits, people doing fun things. This is one of our maintenance guys dressed up in an otter suit, dancing with another partner. And that's part of the videos. We talk about, our residents and what we do. We also have some fun in there. I think what's really exciting is that this idea they were so excited about, we talked about it, said this is more than Lebanon. So they expanded it to all 8 communities. Our lifestyle communities are now doing this. And so our lessons learned from the frontline partner perspective, process didn't make sense. Yes, it did. I can't run a focus group. I can't present this idea to leadership. Yes, you did. And are we really doing this? Yes, we are. As I mentioned, we engaged Red Carpet Learning. We're developing now, we have a mock-up of a 3-day orientation program with engagement and connection and ideas and excitement and great music to start with. So we are going to do this launching in January. And from the leadership perspective, similar to what Candy shared, involving frontline workers and what we do, yes, we will, because it makes a difference, becomes their program, our program, and all that, we believe it's going to make an impact on retaining partners and providing a better job quality between the app and the orientation, and who knows what else is to come. So I'm going to stop sharing and turn this over to Beth Thress from Maple Knoll.
Thank you, Lois. I'm going to share one slide. That looks great, Lois. I'm really impressed with what you were able to do. Okay.
All together.
All together now. So First of all, I'm humbled to be part of this team. I'm getting kind of crabby in my older age, and I'm not really interested in spending time in meetings that don't produce anything for me. But I'm grateful that I stumbled into this group. And the reason I say that is because I'm taking a couple steps backwards, show you a little bit bigger picture of the Maple Knoll journey. In 2017, I started seeing trends among our staff that had me concerned. I had folks leaving pretty quickly. I had people converting from their full-time status to PRN status right as they walked into the door. And I was determined to figure out what in the heck is going on with this. I spent a lot of time talking to the staff. What is it we can do for you? What do you need? The answer was always money. So, initially I started out of the gate doing some sort of a bonus program, tried that for a year, and that didn't seem to produce the results I expected it to. It was right about 2018 when I stumbled into Hope and this gang of wonderful people. That really helped me in the Maple Knoll journey, put some legs under what I was trying to do. Basically, it's been trial and error. I was determined to figure out what is it that gets people to leave or stay. And all these components you've heard about today are part of that bigger picture. It's not just one quick fix. So yes, I heard about money, but the other piece is that when I make more money, I end up having to forfeit other benefits. So in a sense, you are losing money. So if I make more on the hour, but I've lost my childcare vouchers, that is a problem. And that is the kind of information that Hope and her team were able to give me. That was the catalyst to take it to the board of directors and say, listen, we need to do something. We need to do it all. Yes, we need to give them more money, but they also need to be able to participate in any social programs or assistance that they might qualify for. And that's what kind of gave rise to the birth of the Resource Navigator project that all of us have since implemented. Because again, Chantel, the Resource Navigator, her primary role is to really help people have it all. That's what I want for my staff anyway. I want them to make a livable wage, have a career here at Maple Knoll Communities, but also, realizing that wage range is not sustainable for the long term. So assistance may be needed. And having to take off work to fill out forms, to get them to job and family services, all of that kind of stuff is very challenging. And as we dug in further and further, I think last year, Chantel was able to help us with 5 employees who were homeless. 5 people found housing. And these aren't things that, they're going to come out, nor are they wanting to share with everybody. But getting to the heart of the matter has been just tremendous to help us in our journey to figure out what is it that we needed to do. What do we need to do to make this a better experience? Just because I think something's a benefit doesn't mean the same type of benefit that our staff would prefer. So yeah, great. Give me your 401k match. That's fantastic. The professional folks like it, but that's the furthest thing from my frontline workers' mind. They are not thinking about retirement. They're thinking about today and tomorrow. So in my journey, I get hooked up in 2018 with this gang. It's they helped me get some momentum, and it was really through that connection that I was able to make further strides. I did a pay and schedule because it wasn't just pay. It ended up being flexibility to meet their needs. Not only do I need to manage my income, but I also need to manage the days I don't have childcare or I'm trying to go to school or whatever. So in addition to the pay changes I made, we did some creative scheduling to allow folks to have that flexibility that they may need to handle whatever it was in their daily lives. So I tried that for a year. It went very well. In fact, I have two campuses. One campus is still doing amazing as a result, even during COVID, even today. You know, their staffing has been stable, consistent, and just it's a true success story. My other campus struggled a little bit, and so I had to go back to the drawing board. What is going on? What is the deal? And that's where the information about how much our frontline staff really do value feedback and appreciation. You know, I say this like 50 times a week, I think, to our management team, it feels like. And some of our folks get it and some clearly do not, but that seems to be a huge component. You know, I don't care if you're giving me more than somebody else. I can piece together 3 agency jobs and make the same, if not more, but I will not tolerate disrespect or a lack of appreciation and that kind of thing. And that is huge for our staff. So after, you know, sharing this, all of this with my board and my executive team, we had to make some tough decisions in 2019, and we ended up getting rid of some folks, reorganizing. We did a whole organizational assessment and restructuring because we found that we had people who might have been excellent clinically, but they were not leaders, and they were a huge component as to why many of our staff were leaving at that time. So we implemented that right away. And then in 2020, we were able to bring Chantel on site for a limited basis. Again, she's done wonders, as you've already heard. She's kind of that benefit that you know, helps people. It communicates that we do care, but they don't have to disclose anything personal. But she holds them accountable too, which is fantastic. You know, it's almost like having an older sibling going, listen, you need to, you know, stop waiting for this and actually take some action. You know, we've had a lot of successes with that program. We also joined with Ramsey and Design Impact and Ellen in creating some job quality initiatives around the concepts of showing appreciation and respect. I cannot stress enough how important it is. You know, these managers are trying to get work done through these other people. These other people are not just a means to an end. They are human beings with feelings and thoughts and even the most simple expression of gratitude. I just had somebody tell me yesterday, I walked off the job because, you know, there were never any thank yous or any acknowledgement of what we've done and what we've been through, especially over the last couple of years. So our programs are similar to what's been shared, but we created one called the MKC Bucks program. This was to equip our management team to catch people in the act of doing things that were above and beyond what's normally expected. We just kicked that off in July, going very well. We also have a huddle concept that we're going to implement here in probably the new year. I like to call it the group hug, because really it's making that investment, that time, that personal connection with the staff. And that's hopefully going to help, you know, with times like these that are tremendously hard, where you can't get anybody to work. But if there's a personal connection there, it's amazing what people will and can do when they feel they're respected and cared for. So this past year, we've one of my biggest challenges, and I learned through my restructuring of the organization, was that we did not have adequate tools and resources for folks to manage, not easy access to data about what was happening and with turnover and retention. Also, you know, things like not completing people's performance reviews in time, things like that were challenging. So we implemented a whole new software program, so it's kind of a one-stop shop so they can manage their staff and stay on top of those types of things. What's next? I don't know. I don't know, but I know that I'm not giving up until this is over, until we hit the mark. And I am so grateful to be able to share with you today that, I'm not going to say that all of this is a result of this particular journey. There are other factors that play in. But when I recently calculated my turnover and retention, I was pleasantly surprised to see in my workforce of who make $18 or less, through this pandemic, I've had a 90% retention rate. And it is more clear in some departments that actually grasp this whole concept than in others. Some are doing better than others, but overall, I am amazed. It sounds fantastic. Now, that does not mean we're not short-staffed. We were down positions. We're having a heck of a time trying to fill those down positions, but the people who were here hung in here with us. And I just, I'd like to think that even though everything we've tried and done was not always a success, that even just the attention and the efforts made to try to get to the heart of it for most staff are noticed and appreciated. And again, we're just going to keep on working hard and working with our managers, trying to, again, help them want to see why making this investment in their staff is going to pay off in the long run. And when they need someone to pick up a shift tonight, someone who has a relationship versus someone who feels used and abused is much more likely to help us out in a time of crisis. And that's what we've been seeing. So thank you for allowing me to share our journey with you. And I'm going to turn it right back over to Hope.
Thank you. I appreciate that, Beth. And I echo the comments in the chat. 90% retention right now in the work that you do is amazing. And I know all of these employers have had phenomenal results and are just so thankful to be able to be with them and learning along the way with them as well. I thank each of you for your presentations today. We're going to get to the Q&A here in just a minute. But before I do want to go ahead and just capture next steps for everyone. I am dropping this into the chat as well. All of you on the call, wondering how you might be able to continue to go forward, work with these incredible folks and such. First and foremost, you're invited to connect with the Health Collaborative. Our website is workforce.healthcollab.org. Please check it out. You'll get a better feel for all of the work that we're doing in workforce right now. We also have the long-term care employer group. If you're interested in that, please send me an email. We're going to be getting together before the end of the year and we'll get you included in the doodle poll to pick that next date. And then something we haven't talked about, but I have to mention it, the Health Collaborative has an amazing group purchasing organization. And Elisa Lambert is on the call today as one of our attendees. She's available to help you get connected to that. Our members, our long-term care organizations in particular, are saving so much money through this GPO. Please reach out to her if you want to find out about joining it. There's no cost to be part of that. I believe there's no cost to be part of that. She'll tell me if I'm wrong. And then also connect with our partners. We've had only one of our 3 partners on this project talk today, but it's not because of importance. Ramsey Ford, co-founder of Design Impact. We could not have done this work without him. He is here. He's actually a panelist to help answer any questions you might have about human-centered design and the work that we did. Obviously, you've met Ellen, and she's the founder of Work, and her email's here. And then we mentioned the resource navigator. That person, Sue Kathman with Mercy Neighborhood Ministries, helped us to identify and employs them. And if you're interested in finding out about how you might be able to participate with the resource navigator for your organization, she's the one you'll want to reach out to. And then finally, the funding through the National Fund for Workforce Solutions couldn't have gotten this far without them. They have a free career stat network specifically for frontline worker, for health healthcare frontline worker best practice sharing. So I encourage you to go check out their website and sign up to be part of that group as well. So now I'd like to open it up for Q&A. And I do know that we had one question already entered into the chat. I'm sorry, now I just have to find where that went. I am gonna stop sharing so you can see everybody. This is from Patty. She's wondering about the panel's thoughts regarding turnover, intention, and the salary wars competition that we find ourselves in right now, salaries, bonuses, etc. I don't know who'd like to go ahead and comment on that as far as the how that's impacting and how this work could be helpful.
I'll jump in. Oh, go ahead, Candy. You're on mute. Oh, okay. Unfortunately, no easy answer. It's the same thing we're all dealing with. I think someone else mentioned the competition. I can't pay what Amazon pays. It's just not going to happen with Medicaid, Medicare reimbursement. And yes, we've tried wild sign-on bonuses. We thought we were being really big, going like an $8,000 sign-on bonus for nurses, and we find that another place is doing $30,000 bonus. So no easy solution. I do believe that we have to deal with pay and do the best we can with what we have. But I do think, as we've all shared, that some of the things like the resource navigator, like the work we're trying to do or are doing, getting frontline partners more involved, will have an impact. I mean, ultimately, we have to find people who have a calling to work in long-term care, particularly, and in healthcare generally. And then also recognize that our old model of someone being an STNA for 5 or 10 years is not going to happen. So if we can keep them for a year, maybe 15 months might be our new goal. So we're trying to get our minds wrapped around that. Then what does that mean for other processes if that's the new reality, to keep that pipeline flowing with the constraints we have? That's my 2 cents.
Candy, did you start to say something too?
Yeah, very similar. Many of the organizations here are not-for-profit. And so for us to be able to match what other organizations are doing in compensation is unthinkable for us. We're really trying to make our organization a place that is hard for people to leave. So, you know, it's easy to lure people away, but if we can create a culture that people feel connected, you know, I think Beth talked about the fact that people stop calling off when they realize I'm letting down my team. If we can really focus on that core group and establish a workforce that supports each other, where they feel that they're embraced, that this is a group that they don't want to leave. So we're really trying to put our focus on our culture and be a solid employer. We don't want to undersell ourselves at all in terms of compensation. We want to be competitive regarding compensation, but we're not going to be able to offer a $30,000 sign-on bonus. So let's make the best work environment we possibly can, that people want to be here.
I'm still soliciting additional questions, so please, if you have anything, remember we cannot hear you, please enter them into the chat. But I do want to go ahead and offer up, Ramsey, if you have a minute, if you can share. We talked a lot about the how might we's and the human-centered design process. And obviously you've worked with groups all over the country on this. How has your experience in this job quality grant, which I didn't mention, this actually had 6 different communities in addition to, or including Greater Cincinnati involved. How has this transformed your thinking about human-centered design and what it can do for job quality and employers?
No, thanks, Hope. Yeah, no, I mean, I think a lot of the way that we've looked at human-centered design is as both a process that creates tangible changes like the ones that, you know, Lois and Candy and Beth were speaking to, specific programs and policy shifts within the organizations. But then, you know, the other level of that work that we really think about at Design Impact is how by being involved in the work, you start to shift mindsets and behaviors as well. And so we saw that happening through the different organizational engagements. And, you know, I think that that's the piece that really starts to impact, you know, retention, is that when you start having people thinking about collaboration, building that kind of like trust through the process, it's really powerful. And it's been really great for us. I think we worked really closely with Ellen and also the National Fund to take learnings from not just these 3 organizations, but the other dozen or so organizations that we were working with through the program, and have created an online toolkit that explores this with really tangible takeaways that I believe the National Fund in the final aspects of getting up on their website. So excited to share that in the near future as well.
I just want to quickly emphasize that what Ramsey shared, which is from practice wisdom, as well as all the others on the panel here, there is incredibly solid science behind the fact that, as Ramsey was saying, the process is the intervention. The process has an impact. When it generates that kind of perceived organizational support, that is associated with all the outcomes we're going after, including reducing turnover intent. So although it's a commitment by the organization, there is a payoff simply from going through the process to create those new approaches.
Thank you. I appreciate that. And I also appreciate that we're at time. I thank all of you for coming and joining us and hearing our story today. We have recorded this and we'll be sending the link out. And just hope that you will take advantage of the different ways we've given you to connect with us in the future and get engaged with us on this work. Thank you and have a great day.